Most people believe if they're eating healthy and staying active, their arteries are protected. Clean diet, regular walks, managing stress, doing everything right. I've seen that confidence shatter on the operating table more times than I want to count. A 68-year-old retired teacher, yoga 3 times a week, vegetarian for 2 decades, no smoking, barely drinks, perfect blood work at her last checkup 6 months prior. And then one Tuesday morning, she collapsed in her kitchen reaching for her morning tea. The damage I found when I opened her chest wasn't from some exotic toxin or rare disease. It was from something she did every single day, something her doctor never warned her about, something that millions of people over 60 are doing right now without realizing what it's quietly doing to their arteries. Here's what nobody tells you, what I'm going to tell you today, starting right now. My name is Dr. Marcus Chen. I'm a cardiothoracic surgeon with 28 years in the operating room. I've opened over 2,300 chests. I've held beating hearts in my hands. And I've spent nearly 3 decades watching the same preventable patterns repeat. Patients who did everything their primary care doctor told them to do and still ended up on my table with arteries that look decades older than their chronological age. Today, I'm going to tell you what nobody took the time to explain to them. The habit I'm about to reveal isn't some obscure medical knowledge. It's hiding in plain sight. And it's accelerating arterial damage in a way that most people, and honestly, many doctors, don't fully appreciate until it's too late. Your arteries after 60 are fundamentally different from what they were at 40. Think of a garden hose. When it's new, it's flexible. Water flows smoothly. The walls expand and contract with every surge. But leave that hose outside through 20 winters, 20 summers, constant pressure cycles, and what happens? The rubber gets stiff. It can't flex anymore. It starts to crack from the inside. That's your vascular system after 6 decades of continuous use. The medical term is arterial compliance, the ability of your blood vessels to expand and contract with each heartbeat. After 60, that compliance drops by 30 to 50% in most people. Your endothelial cells, the delicate inner lining of every blood vessel, begin producing less nitric oxide. They become more permeable to inflammatory molecules. They lose their ability to repair micro-injuries that happen thousands of times per day from normal blood flow turbulence. The margin for error that your body had at 35 is gone. And that means habits that were merely suboptimal in your 40s become genuinely dangerous in your 60s and 70s. More than 65% of adults over 65 have some degree of arterial stiffness that wasn't there a decade earlier. And here's the critical part. Stiff arteries don't just raise your blood pressure. They magnify the damage from every other risk factor you have, including this one. Now, this next one surprises people every time I bring it up in consultations. The habit that's slowly destroying arteries in millions of people over 60 isn't late-night eating. It isn't sitting too much. It's the way you're heating your food. Specifically, reheating certain foods at high temperatures in ways that create compounds your aging arteries can't handle anymore. Stay with me. Let me show you exactly what's happening. When you reheat food, especially fatty foods, oils, or foods cooked in oil, past a certain temperature threshold, the fats undergo oxidation. That oxidation produces what are called lipid peroxides and aldehydes. In a younger body, your antioxidant systems can neutralize most of that damage before it reaches your artery walls. But after 60, those defense systems are running at maybe 60 to 70% of their former capacity. Your liver produces less glutathione. Your cells produce less catalase. The cleanup crew is smaller. And those aldehydes, they don't just pass through harmlessly. They bind to LDL cholesterol in your bloodstream and turn it into oxidized LDL. That oxidized LDL is what actually lodges in your artery walls and starts the plaque formation process. Here's a real example. Leftover stir fry, cooked yesterday in vegetable oil. You put it in the microwave on high for 3 minutes. That oil, which was already heated once, is now being heated a second time, often past its smoke point. Each reheating cycle produces exponentially more of these toxic compounds. A patient I'll call Margaret, 71 years old, former accountant, proud home cook, came to me after an abnormal stress test. Her cholesterol wasn't terrible. Her blood pressure was managed, but her coronary calcium score was shockingly high for someone who ate what she considered a very clean diet. When I asked about her daily routine, one pattern stood out. She meal prepped every Sunday, big batches, reheated portions throughout the week, often reheating the same dish 2, sometimes 3 times if she forgot to finish it. She had no idea that this habit, which she thought was healthy and efficient, was flooding her system with arterial toxins multiple times a day, every single day, for years. Let me ask you something. How many times this week have you reheated leftovers in oil or fat, rice fried in oil, roasted vegetables tossed in olive oil, grilled chicken that sat in marinade? Write that down. Because if the answer is more than twice, this is affecting you. The fix here is simple, but requires discipline. If you're going to reheat food, do it gently. Use the lowest heat setting that gets the job done. Better yet, add a tablespoon of water to the dish before reheating. It creates steam, which heats the food without pushing the oils past their breakdown point. And here's the rule that changed outcomes for dozens of my patients. Never reheat the same portion more than once. One reheat maximum. After that, the cumulative oxidative load is too high. If you batch cook, portion it immediately after the first cooking. Freeze what you won't eat in 48 hours. Thaw and eat cold if possible, or reheat once, gently, and finish it. Let me ask you before we go further. Do you drink your morning coffee or tea on an empty stomach? Most people do. That's habit number 2, and it's directly damaging your arterial lining in ways that compound with age. Here's what happens. Caffeine on an empty stomach triggers a sharp spike in cortisol and adrenaline. That's the jolt you feel. That's your stress hormones surging. In a younger body, that surge is temporary and your system recalibrates quickly. But after 60, your adrenal response doesn't shut off as cleanly. Your hypothalamic pituitary adrenal axis, the system that controls stress hormones, becomes less responsive to feedback signals that should tell it to calm down. The elevated cortisol lingers, and sustained cortisol does something very specific to your blood vessels. It activates an enzyme called 11-beta-hydroxysteroid dehydrogenase type 1. That enzyme increases local cortisol concentrations in your vascular smooth muscle cells. The result? Endothelial dysfunction. Your artery lining loses its ability to produce nitric oxide, the molecule that keeps blood vessels relaxed and flexible. Less nitric oxide means stiffer, more reactive arteries. And it means your blood pressure spikes higher and stays elevated longer after every stressor. Every single morning, this cycle repeats. Your arteries never get a break. I had a patient, I'll call him Robert, 66, retired postal worker. He'd start every morning the same way for 40 years. Black coffee at 5:30 a.m. Nothing else until 9 or 10. Thought he was being disciplined. Thought fasting was heart healthy. And his morning blood pressure readings were consistently 20 to 30 points higher than his evening readings. That's called a morning surge. It's dangerous. And his coffee ritual was the primary trigger. Does this sound familiar to you? You're not alone. The fix is almost too simple. Eat something small with protein or fat before your coffee. Half a boiled egg, a tablespoon of almond butter, a small piece of cheese. That small amount of food in your stomach blunts the cortisol spike by 40 to 50%. Your adrenal system still wakes up, but it doesn't go into emergency mode. Your arteries thank you for it. Starting tomorrow morning, not next week, tomorrow. 2 more items after this one. And item 4. That's the one that even I had a significant blind spot about for the first 15 years of my career. Stay with me. This one is the hardest to talk about because it involves medication that millions of people take daily, prescribed by doctors they trust. Non-steroidal anti-inflammatory drugs, NSAIDs, ibuprofen, naproxen, even aspirin in some cases. The problem isn't that they don't work. They do. The problem is what they do to your arteries when you're over 60 and taking them regularly. NSAIDs block an enzyme called cyclooxygenase. That enzyme produces prostaglandins, molecules that, among other things, protect your stomach lining and regulate blood flow in your kidneys and arteries. In a younger person, occasional NSAID use is usually fine. The body compensates. But after 60, your kidney function is already declining. Your prostaglandin production is already lower. And chronic NSAID use, even just 200 milligrams of ibuprofen 3 times a week, tips the balance into dangerous territory. It raises blood pressure. It reduces blood flow to the kidneys, which makes your body retain sodium and water. And critically, it interferes with the antihypertensive medications you might already be taking. Here's what nobody tells you. If you're on blood pressure medication and you're also taking ibuprofen for knee pain or back pain 2 or 3 times a week, those 2 drugs are fighting each other. The ibuprofen is undoing a significant portion of what your blood pressure pill is trying to accomplish. A patient came to me at 69. I'll call her Diane. Controlled hypertension for a decade, good compliance with her medications. But over 6 months, her BP crept up. Her cardiologist increased her dose, still creeping up. We reviewed everything, and buried in her daily routine was this. She'd been taking ibuprofen every night before bed for hip discomfort, just 200 milligrams, for 8 months straight. That's all it took. Within 2 weeks of stopping the ibuprofen and switching to acetaminophen, her blood pressure dropped 18 points systolic. No other changes. Have you been taking NSAIDs regularly, even just a couple times a week? Most people have. Here's the question to ask your doctor. Write this down. Is there a safer alternative for managing my pain that won't interfere with my blood pressure control? That one question might be the most important conversation you have this year. For pain management, acetaminophen is often safer for your cardiovascular system after 60. For inflammation, there are non-drug options: heat therapy, physical therapy, topical agents that don't carry the same arterial risk. Here's where it gets complicated. And this is the blind spot I mentioned. For years, from early in my residency all the way through my first decade as an attending, I believed calcium supplementation was unambiguously good for seniors. Osteoporosis prevention, bone health, standard recommendation. Then the data started coming in, and it wasn't what we expected. Calcium supplements, when taken without the right cofactors, don't just go to your bones. A significant portion ends up in your soft tissues, including your artery walls. It's called vascular calcification, and it's one of the strongest predictors of heart attack and stroke risk in people over 60. The irony is brutal. You take calcium to strengthen your bones, to prevent fractures, to maintain your independence. And if you take it wrong, you're hardening your arteries in the process, trading one risk for another. The missing piece is vitamin K2, specifically the MK7 form. K2 activates a protein called matrix glyprotein, or MGP. MGP's job is to keep calcium out of your arteries and guide it into your bones where it belongs. It's like a traffic controller. Without adequate K2, calcium from supplements or even from your diet can deposit in your arterial walls, making them stiffer and more brittle. Most Western diets are severely deficient in K2. It's found in natto, certain fermented cheeses, egg yolks from pasture-raised chickens, and organ meats, foods most people don't eat regularly anymore. I had a patient, called him Edward, 74, taking 200 milligrams of calcium citrate daily for bone health. His doctor recommended it after a DEXA scan showed mild osteopenia. No one mentioned K2. Over 3 years, his coronary calcium score went from moderate to severe. His bones improved marginally, but his arteries paid the price. What do you take daily? Calcium? A multivitamin with calcium? Check the label right now. Does it include K2? Most don't. The fix. If you're taking calcium supplements, you must pair them with 100 to 200 micrograms of vitamin K2 MK7 daily. And if you're on a blood thinner like warfarin, you need to have a conversation with your doctor first. K2 affects clotting pathways, and your dosing may need adjustment. But do not keep taking calcium alone. That is a direct path to arterial damage that you can prevent with one additional supplement that costs less than $10 a month. I need you to hear this clearly because this is where the most preventable damage happens. Your evening meal. Specifically, the time you eat it and what you eat first. Most people eat dinner between 7 and 9 p.m. That's fine. The problem is the order. Bread first, or rice, or pasta. High glycemic carbohydrates hitting your bloodstream first, spiking your insulin, and then everything else follows. After 60, your insulin sensitivity is already compromised. Your pancreas has to work harder to clear the same amount of glucose from your blood. And every insulin spike creates a corresponding inflammatory cascade that damages your endothelial cells, the cells that line your arteries. Chronic inflammation is the fertilizer for plaque growth. But here's the intervention that almost no one talks about. Eat your vegetables first. Literally, start your meal with a plate of non-starchy vegetables. The fiber in those vegetables slows gastric emptying. When the carbohydrates arrive 10 or 15 minutes later, they're absorbed much more slowly. Your blood sugar spike is blunted by 30 to 40%. Your insulin response is gentler, and your arterial lining doesn't get hammered with the same inflammatory load. A study out of Weill Cornell showed that meal sequencing alone, vegetables first, protein second, carbs last, reduced postprandial glucose spikes by an average of 37% in adults over 65. No medication, just order. A patient I worked with, Margaret actually, the same woman I mentioned earlier who was reheating food multiple times, changed nothing about what she ate. Same foods, same portions. She just rearranged the order. Salad first, always. Protein second. Rice or bread last, if at all. 3 months later, her A1C dropped from 6.1 to 5.7. Her inflammatory markers, CRP, homocysteine, both down significantly. Which of these habits do you recognize in your own evenings? Tell me in the comments. I read every single one. Because the truth is, most of you reading this aren't doing just one of these things. You're doing 3, maybe 4 of them, and they're compounding. The reheating, the coffee, the NSAIDs, the calcium without K2, the carb-first dinners. Each one alone might not be catastrophic. But together, over months and years, they create an environment in your arteries that accelerates aging and damage faster than your genetics ever intended. I want to be honest with you for a moment, not as a content creator, as a surgeon. I have stood at an operating table at 3 in the morning, holding a heart that looked 20 years older than the person it belonged to. I have felt calcification under my fingers, where there should have been smooth, pliable tissue. I have watched hearts struggle to pump blood through arteries so stiff they barely moved with each contraction. I have spoken to families in waiting rooms at dawn, families who had no idea anything was wrong when they said goodnight 8 hours earlier. Husbands asking me how their wives went from making dinner to needing emergency surgery. Children trying to understand why their father, who seemed perfectly healthy yesterday, is now fighting for his life. In case after case, the contributing factors were not mysterious. They were leftover stir-fry reheated 3 times, black coffee on an empty stomach every morning for decades, ibuprofen taken casually for aches without a second thought, calcium supplements without the cofactors that make them safe, bread before vegetables at every dinner. These are not exotic risk factors. These are not genetic conditions that medical science cannot touch. They are the background noise of millions of ordinary kitchens and ordinary mornings. And that background noise, accumulated day after day, year after year, calcifies arteries and weakens hearts in ways that no amount of genetic luck can fully protect against. The hardest part of my job is not the technical surgery. It is knowing that in so many cases, we could have prevented this. Not with expensive treatments or cutting-edge drugs. With information. With conversations that take 5 minutes. With small changes that cost nothing. I want to tell you about a patient. I'll call her Linda. 69 years old, former high school English teacher, grandmother of 5. She came to me after a routine echocardiogram showed significant left ventricular hypertrophy. Her heart was working too hard, thickening in response to chronic stress. Her blood pressure was managed with medication. Her cholesterol was decent, but something was driving the damage. We went through her entire daily routine in detail. Every meal, every supplement, every habit, and there it was. Every single habit I've just described. Reheating the same meal prep containers multiple times. Coffee at 5 a.m. on an empty stomach. Ibuprofen 3 times a week for arthritis. A calcium supplement her previous doctor recommended. No K2. Pasta or rice at the start of every dinner. She wasn't doing anything she thought was wrong. She thought she was being responsible. Efficient. Health conscious. Doing exactly what she'd been told to do by well-meaning sources for years. I gave her 5 changes. No new medications. Just these 5 behavioral shifts. 6 months later, her follow-up echo showed measurable improvement. Her left ventricular wall thickness had decreased. Her ejection fraction improved from 52% to 58%. Her blood pressure medication was reduced from 2 pills to 1. Her inflammatory markers, C-reactive protein, homocysteine, dropped into normal range for the first time in years. The first thing she said to me was, "Why didn't anyone tell me this 5 years ago? Or 10? How much damage could I have prevented?" That question has stayed with me. It's a big part of why I make videos like this one. Let me recap the 5 habits clearly. 1. Stop reheating the same food multiple times, especially foods cooked in oils or fats. Reheat once, gently, with added moisture, or eat it cold. 2. Never drink coffee or caffeinated tea on an empty stomach in the morning. Eat a small amount of protein or fat first. It blunts the cortisol surge that damages your arterial lining. 3. If you're taking NSAIDs regularly for pain, even just twice a week, talk to your doctor about safer alternatives that won't interfere with your blood pressure control. 4. If you're taking calcium supplements, make sure you're also taking 100 to 200 micrograms of vitamin K2 MK7 daily to prevent arterial calcification. 5. At dinner, eat your vegetables first, protein second, and carbohydrates last. That order alone can reduce your post-meal glucose and insulin spikes by 30 to 40%. Which of these habits do you recognize in yourself? Tell me in the comments. I read every single one. There is someone in your life, a spouse, a sibling, a friend, who needs exactly this information. Send it to them. That one share might be the most important thing you do today. Every week, I bring you honest, evidence-based information that I wish every one of my patients had access to long before they needed surgery. If you want more of that, subscribe. One last thing, and this is important. Everything I've shared today is based on published research and my clinical experience as a cardiothoracic surgeon. But your situation is unique. Your history is individual. Before changing anything, any medication, any supplement, any routine, please talk to your own physician first. That conversation is not a formality. It is the whole point. Better information, better conversations, better outcomes. That's the chain that matters. Your heart has been working for you every single minute of every single day for 60 or 70 years without ever asking for anything in return. Give it this. Take care of your heart.